My name's Dr. Peter Larsen. I'm an interventional cardiologist and structural heart valve specialist, and I work here on the Sunshine Coast. I've been working here for more than 10 years. When I first came back, we didn't have any advanced heart facilities here on the coast, and I had to drive to Brisbane to look after my patients. But now, with a team of specialists, we can deliver world-class care locally, and that's been an amazing journey to be part of. The key symptom for aortic stenosis, when that aortic valve fouls, becomes narrowed and the blood builds up on the lung, it's breathlessness. And we've all seen older patients who are breathless, and it's hard to know, is it their lungs, is it their heart, are they just getting older, are they slowing down because they're getting older? And it's hard to diagnose sometimes. And when patients have breathlessness or chest tightness or dizziness, then as a cardiologist or as a general practitioner, we're thinking, could it be secondary to their heart? Could their breathlessness, their dizziness or their chest tightness be because they have aortic stenosis or another heart problem? The easiest way to get a clue that it may be aortic stenosis is to listen to someone's chest using a stethoscope. And typically we would hear a heart murmur, which is a harsh sound as the blood is rushing through that narrowed valve. And that gives us the clue that they may have aortic stenosis as the cause for their symptoms. And the next test is an echocardiograph or ultrasound of the heart, where we're able to measure the area of the aortic valve and the velocity of that blood. And there are set criteria, and we know that if the area of the valve is less than 1 centimetre square, then that patient has severe aortic stenosis. And without treatment, their prognosis is terrible. TAVI is a treatment for aortic stenosis. Aortic stenosis is where the aortic valve, which is the main valve that lets the blood out of the heart, becomes degenerated and narrowed, becomes hard and calcified. Approximately 40 years ago, they invented coronary stents. So patients who'd had heart attacks could have a stent rather than have a coronary artery bypass graft surgery. And similarly, TAVI, which is transcatheter aortic valve implantation, allows patients to undergo replacement of their aortic valve by being able to do this keyhole procedure through a small incision in the leg to advance the valve through the femoral artery up to the heart without having a stenotomy and open heart surgery. So the recovery is much quicker. Like any procedure, TAVI has its risks and benefits. The benefits are obvious. We can replace that narrowed valve with a new one, and the patient's symptoms will be instantly improved. The risks are very low. Less than 1% chance of a major complication such as death, stroke or heart attack. Because we're going through the femoral artery in the groin, bleeding and bruising in approximately 2 to 3% of cases, it can be an issue. And some patients, because they're older and their heart's worn out a little bit, require a pacemaker. Both TAVI and surgical aortic valve replacement are great procedures. They're both simple and safe in the majority of patients. And so it's choosing the right operation for the right patient. The main difference is that for surgical aortic valve replacement, a patient needs a stenotomy, which is open heart surgery. And that brings with it increased risks of a longer hospital stay, increased risk of stroke, and prolonged recovery, typically 6 weeks before they get back to the basic level of activities of daily living. TAVI is minimally invasive and it's done through a small incision in the leg. And most patients are discharged the following day. So practically, TAVI is much quicker, much simpler, and it's been proven to be safer. So it's understandable that most patients, when presented with a choice, choose TAVI rather than surgical valve replacement.